Good morning, everyone, and welcome to PGR's webinar on ISO 13485-2016. Are you ready for this? My name is Shannon Craddock, and I'm the Programs and Accreditations Manager at PGR, and I'm delighted to be today's presenter. All participants have been muted to ensure sound quality. I'll be more than happy to field any questions that you have at the end of today's prepared presentation. Please type them into the question feature and I'll go through and answer as many as possible. So today we're going to talk about the transition requirements. If you are currently certified, what are the transition timing requirements, the audit duration, etc. We'll go through an overview of the changed, some new requirements, as well as some deleted requirements, and then there'll be a period of Q&A at the end. ANAB, the accreditation body in the United States, published Heads Up 340 relating to the transition process for both certification bodies and certification body clients. The standard itself was published on March 1st, 2016, and IEF International Accreditation Form Resolution 2015-13 detailed a 3-year transition period. So any 1345-2003 certificates will be valid until February 28th, 2019. Certification bodies have to apply to transition their accreditation to be able to offer the 2016 version. And once approved, we're able to issue certificates to the 2016 version. PGR has already completed this process. We're accredited to issue 2016 certificates. For organizations that are transitioning, I strongly encourage you to transition on your recertification audit. We will be adding no additional time if you choose to transition on your recertification audit. If you decide to transition on an annual surveillance audit, we will be adding a half day to your audit in order to ensure we have sufficient time on these shorter duration audits to audit all the new and changed requirements. So let's start taking a look at changed, new, and deleted requirements, starting in section 0.1 general. We're not even in the normative requirements yet. And this section includes more detail regarding the types of organizations that are applicable to 13485. So organizations in various stages of the life cycle of the medical device are applicable for certification, including those organizations involved in design and development, obviously production of the medical device, the storage and distribution of the device, if you're doing installation or servicing, usually of a complex active machine that may be integrated with multiple components, the final decommissioning and disposal of medical devices, and the design, development, and provision of associated services, maybe software development, sterilization or sanitization services. Types of organizations involved in 1345, it can be applied to suppliers or external parties providing product. That includes raw material, components, sub-assemblies, medical devices, sterilization services, calibration services, distribution and maintenance services to such organizations. 1345-2016 requires the organization to identify a role under applicable regulatory requirements, and we'll talk about those roles in a few slides. And then once you determine what your role is, identify the regulatory requirements that apply to its activities under these roles. And of course, incorporate these regulatory requirements into your quality management system. Okay, moving on to section 0.2, clarification of concepts. Here we use the term as appropriate. And as appropriate is deemed to be appropriate unless an organization can justify otherwise. A requirement is always considered appropriate if it is necessary for compliance with applicable regulatory requirements or for the organization to manage risks. And keep in mind that the word risk pertains to safety or performance requirements of the medical device or meeting applicable regulatory requirements. More clarification in section 0.2. If something's documented, it's understood to mean established, implemented, and maintained. So not just written down. That's the first step. But making sure it's automatic and intrinsic and instinctive to all of your people, and they're performing it consistently. And of course, product means service. 0.3, just like the 9001 base standards, emphasis on the process approach, and these additional requirements really drive the process approach to quality management. Understanding and meeting requirements, considering processes in terms of added value. So what are your processes? Obviously, they transform inputs into outputs. Are they meaningful? Are you measuring them? Are you reacting to them? I.e. obtaining results of process performance and effectiveness, and then making improvements to your processes based on this objective measurement. Section 1, scope. Again, we have a reiteration of the expanded applicability of the standard in terms of the life cycle stages and inclusion of suppliers and external parties. Many certification bodies certify suppliers of component parts to medical devices, so folks that don't actually hold the medical device license. The new version of 1345 now makes it very clear that the standard is applicable to you, although many of those organizations are currently certified to 1345 2003. Clarification here that outsourced processes are the responsibility of the organization and are to be accounted for in the organization's quality management system by monitoring, maintaining, and controlling the process. And we'll see this when we get into the purchasing requirements. And there's a clarification that requirements in sections 6 and 8, as well as those in section 7, can be justified as non-applicable. Remember, anything related to compliance with a regulatory requirement or related to risk really is always considered applicable. Now is a great time to point out that 1345 has not adopted the Annex SL system of numbering that's been adopted by the new versions of ISO 9001, IATF 16949, the aerospace standards. We still have sections 4, 5, 6, 7, and 8 as opposed to the 10 sections found in some of the 9001 base standards. There are a lot of new terms and definitions in section 3 of ISO 1345-2016, and I encourage you to take a look at these. We could do a whole hour webinar on just the changes in the terms and definitions of section 3. So for the purpose of this general overview, I've selected what I think are the most important terms. 3.2, one of the roles that an organization can identify as is an authorized representative, a natural or legal person established within a country or jurisdiction who has received a written mandate from the manufacturer to act on his behalf for specified tasks with regard to the latter's obligations under that country or jurisdiction's legislation. I would expect that very few organizations would identify with this role. Also want to define a complaint, and this differs than the 9001-2015 definition of a complaint. A written, electronic, or oral communication that alleges deficiencies related to the identity, quality, durability, reliability, usability, safety, or performance of a medical device that has been released from the organization's control, or that's related to a service that affects the performance of such medical devices. So here we have a very specific definition of a complaint related to the medical device. Okay, back to one of the 4 roles an organization can identify as. The next would be a distributor. a natural or legal person in the supply chain who, on his own behalf, furthers the availability of the medical device to the end user. There may be more than one in a particular supply chain, and those folks involved in storage, transport on behalf of the manufacturer, importer, or distributor are not distributors under this particular definition. An importer is the natural or legal person in the supply chain who is the first in the supply chain to make a medical device manufactured in a different country or jurisdiction available in the country or jurisdiction where it is to be marketed. So it's that first interface in a new geographic location. And I expect that most folks will identify as a manufacturer, a natural or legal person with responsibility for design and or manufacture of a medical device with the intention of making the medical device available for use under his name, whether or not such a medical device is designed and or manufactured by that person himself or on his or her behalf by another person. And there's multiple notes under this definition. I would encourage you to look at those in section 3.10. Okay, as we get into the changed, new, and the few deleted requirements, you'll note that in the new 1345-2016, there's no longer use of the italicized font to identify requirements that were kind of above and beyond the 9001 requirements or medical device specific. Okay, 4.1, here we see under general requirements that the organization shall document the role undertaken by the organization under the applicable regulatory requirements. So here, as appropriate, you would identify as a manufacturer, authorized representative, importer, or distributor. This needs to be documented somewhere. It could be part of your quality manual. You can document it elsewhere, but you need to document the role that's taken. 4.1, more in the general requirements. 412A, the organization shall determine the processes needed for the quality management system and the application of these processes throughout the organization, taking into account the role undertaken by the organization. And remember, you identify your role in the previous slide. And then apply a risk-based approach to the control of the appropriate processes needed for the quality management system. So again, really using the process approach that they've reiterated in earlier sections of 1345. Identify the processes, manage them using the process approach, a risk-based approach. We're all in business. There's always a finite amount of resources to go around. So based on risk, you're going to dedicate more resources to those processes that are high risk. 414A through C, changes to the QMS processes shall be evaluated for their impact on the QMS, evaluated for their impact on the medical devices, and controlled in accordance with 1345 and regulatory requirements. Okay, from time to time in section 415, an organization will make a business decision to outsource a process. Outsourcing a process that does not relieve them from responsibility for conformity of that process. They're expected to monitor and control that process, usually through the purchasing requirements. Retain responsibility for conformity to all 1345 customer and regulatory requirements. And the controls put in place over that outsourced supplier shall be proportionate to the risk involved and the ability of the external party to meet requirements. So obviously there would be a lot of controls applied if you were outsourcing something to an organization that didn't have a management system that was certified to 1345 or 9001 or 17025 as appropriate. They do state here that the controls shall include written quality agreements. Now, there may certainly be other controls, but at minimum, there needs to be written quality agreements between the organization and the outsourced supplier. 416, if you are involved in validating computer software used in your quality management system, you need to have a documented procedure for this. Software needs to be validated prior to use in response to any changes. Your approach to software revalidation shall be proportionate to the risk associated with use of the software. And then you have to maintain records of your software validation activities. .423, medical device file. For each medical device or medical device family, the organization has to maintain a file that contains or references documents required by 1345 and applicable regulatory requirements. The file contents are listed. I'll read through them. General description of the device, including the intended use or purpose, labeling and instructions for use, the specs for the product, specifications or procedures for manufacturing, packaging, storage, handling, and distribution, procedures for monitoring and measuring, requirements for installation and servicing as appropriate. The procedure for control of documents, moving to 424, needs to address preventing deterioration or loss of documents. So something new that needs to be covered in this procedure. And per 425, control of records, the organization is required to define and implement methods for protecting confidential health information contained in records in accordance with regulatory requirements. So how are you going to ensure appropriate maintenance of personal health information, PHI? There's a requirement here that is defined. Management review. Organization has to have documented procedures for management review. Top management must review the QMS at documented plan intervals. There's some new inputs as well. Feedback, which was previously just defined as customer feedback. Complaint handling and reporting to regulatory authorities are some of the new requirements. So the definition of feedback is more broad. It can be feedback from other interested parties, your certification bodies, suppliers, etc. Okay, moving on to 6.2, human resources. Requirement here for a documented process for establishing competence, providing needed training, and assuring awareness of personnel. I see a lot of organizations struggle with this. Training records in someone's personnel file does not meet this requirement. You need to be able to show that you've determined what the competencies are for a given position, and then show that that person is meeting all of those defined competencies. One way to meet a competency is by the provision of training, but it's not the only way. So the step that's often missing is this crucial first step of establishing competence and needs. 6.3, infrastructure. The organization has to document, again, another requirement for documentation. Document the requirements for the infrastructure needed to prevent product mix-up and ensure the orderly handling of product. Infrastructure was clarified to include any information systems that you're using, an MRP program, an SAP program. And maintenance was clarified to be applicable to equipment used in production, controlling the work environment, and monitoring and measurement. .641, work environment. The organization has to document, again, another requirement for something to be written down. Document the requirements for the work environment needed to achieve conformity to product requirements, certain temperature, certain humidity requirements, electrostatic discharge requirements, whatever it is. Contamination control specifically is covered in section 642. For sterile medical devices, the organization again has to document requirements for control of contamination with microorganisms, particulate matter, and maintaining required cleanliness throughout assembly and packaging. Okay, moving to section 7. 7.1b, planning of product realization. The organization needs to provide resources specific to the product, including infrastructure and work environment. Essentially, the organization needs to give people the tools they need to do their job, both tangible and intangible tools. 7.1c, the organization shall determine required handling, storage, distribution, and traceability activities that are needed. Seven point 2, customer-related processes. Additional requirement here that the organization has to determine any user training needed to ensure the specified performance and safe use of the medical device. And in the review of requirements related to the product, this has to occur prior to the organization's commitment to supply product to the customer and ensure that applicable regulatory requirements are met and any user training previously identified is or will be available. Again, all done prior to the commitment to be able to supply the order. Some changes, some additions and deletions as well relating to design and development. And the first is in 7.3.2, design and development planning. During design and development, the organization must document what reviews are needed at each design and development stage. So plan out at what stage in the life cycle of the design process reviews are needed. What methods will be used to ensure traceability of design and development outputs to design and development inputs. And specifically what competencies are going to be needed and other resources. Then an elimination of the requirement for management of interfaces. Seven 3.3, design and development inputs. Inputs relating to product requirements must be determined and records maintained. They clarified that inputs shall include usability requirements, and requirements shall be able to be verified or validated. More on this in a few slides. So in the planning stages, you are required to identify when design reviews are needed. As you conduct a design review, it has to include the identification of the design under review, who was involved, and the date of the review. So those records need to look a particular way. Design and development verification, 7.3.6. The organization is required to document verification plans that include methods, acceptance criteria, and as appropriate statistical techniques with rationale for the sampling size, i.e. what is your strategy? In those situations where the intended use of the medical device requires a connection or interface with another, then the verification activities shall include confirmation that the design outputs meet the inputs when it is in fact connected or interfaced. And you need to maintain records of the results and conclusions of verification and necessary actions. Validation, again, mirrors the verification requirements. You need to document validation plans, including methods, acceptance criteria, and as appropriate statistical techniques with a rationale for sample size. You need to record the rationale for your choice of product used for validation. When there's an interface or a connection with another medical device, the validation activity needs to be conducted in such a way that design outputs meet the design inputs when it is connected or interfaced. And you need to maintain results and any conclusions or decisions made as a result of the design validation activity. New requirement for design and development transfer. And I think something very important, looks like it's mirroring some of the production approval requirements from automotive standards. The organization has to document procedures for transfer of design and development outputs to manufacturing. The procedure has to ensure that outputs are verified as suitable for manufacturing before final production specs and production capability can meet product requirements. And the results and the conclusions of the transfer shall be recorded. 739, design and development changes. The organization has to determine the significance of the change to the function, performance, usability, safety, and applicable regulatory requirements for the medical device and its intended use. And the review of the design and development changes shall include the evaluation of the effect of the change on constituent parts, work in progress, delivered product, inputs, outputs of risk management, and the product realization process. 7310, a new requirement for design and development files. The organization has to maintain a design and development file for each device or device family. The file must include a reference record generated to demonstrate conformity to the requirements of design and development, and include or reference the records for design and development changes. Okay, moving into section 7 for purchasing. There's new criteria for the evaluation and selection of suppliers, and the criteria needs to be based on the performance of the supplier and be proportionate to the risk associated with the medical device. The organization needs to plan the monitoring and reevaluation of the supplier, including their ability to meet requirements for purchased product. So you have to be doing this ongoing monitoring, and that should be an input to the reevaluation that you do of the supplier. So the monitoring itself is not your reevaluation. There needs to be a decision made about the continuing suitability of the supplier. If you have a situation where purchasing requirements are not met, this shall be handled based on risk associated with the purchased product in compliance with the applicable regulatory requirements. And you need to be maintaining records of all the selection, monitoring, and reevaluation of suppliers that you're doing. Oftentimes going into organization, we'll see good records relating to the initial selection of suppliers, but sparse records relating to monitoring and reevaluation. The purchasing information must include, as appropriate, a written agreement that the supplier notify the organization of changes in the purchased product prior to implementation of any changes that affect the ability of the purchased product to meet specified requirements. So the supplier has to notify the organization of any changes to what's being purchased prior to the implementation of any of these changes. 743 talks about the verification or incoming inspection of purchased product. When the organization is aware of any changes to the purchased product, the organization must determine whether these changes impact the product realization process or the medical device. (752) Cleanliness of product. The organization shall document requirements for cleanliness of product or contamination control of product if the product cannot be cleaned prior to sterilization or its use and its cleanliness is of significance in its use. Again, there's a requirement here for documentation. (754) Servicing activities. The organization shall analyze records of servicing activities carried out by the organization or its suppliers to determine if the information should be handled as a complaint and as an input to the improvement process as appropriate. (756) Validation of processes for production and service provision. Requirement for the organization to document procedures for validation of processes. These procedures need to include revalidation criteria for revalidation and approval of changes to processes. There's a requirement for a documented procedure for validation of computer software. This is not changed from 1345. The specific approach that's used by the organization needs to be proportionate to the associated risk and the effect of the ability of the product to conform to specifications. The records of results, conclusions, necessary activities from any validation activities need to be maintained. In 757, we have the introduction of a concept called sterile barrier systems. This could be maybe plastic packaging that is holding a medical device or medical device components. Processes need to be validated prior to implementation and following product process changes. Results from records of results and any necessary actions from validation activities shall be maintained. There's specific reference to ISO 11067-1 and -2. 758 relates to identification of medical devices, and if required by regulatory requirements, the organization has to document a system to assign a unique device identification to the medical device. This may be required for certain types of medical devices. And the organization has to document procedures to ensure that medical devices returned to the organization are segregated, identified, distinguished from conforming product. So this identification section relates to identification of product and identification of product status as well. 7511, preservation of product. The organization must protect product from alteration, contamination, damage during processing, as well as storage, handling, and distribution by designing and constructing suitable packaging and shipping containers. Documenting requirements for additional special handling conditions needed if the packaging alone is not sufficient. And if special conditions are needed, they must be controlled and recorded. Again, some additional requirements for documentation here. We're seeing that theme come up a lot. 821, feedback. The organization must document procedures for a feedback process, including production and post-production activities. And any feedback that's gathered shall be a potential input into risk management for monitoring and maintaining product requirements, as well as the product realization or improvement processes. So an organization may get some feedback, may make a decision not to document it as a complaint and justify their rationale for doing so. However, that feedback still needs to be part of a process for continual improvement to the management system. 822, there's a brand new section here on complaint handling. Requirement for a documented procedure for timely handling of complaints in accordance with applicable regulatory requirements. If an organization decides not to investigate a complaint for whatever reason, that rationale has to be documented. And if an organization's investigation into a complaint reveals that activities outside of the organization completed to a complaint, maybe the outsourcing of part of the manufacturing process, maybe it's related to the distribution or transport, the relevant information needs to be exchanged between the parties and they need to be part of the complaint handling process. And obviously records need to be maintained of every stage of this. New requirement here, 823, reporting to regulatory authorities. If applicable, regulatory requirements require notification of complaints that meet specified recording criteria of either an adverse event or issuance of an advisory notice, the organization has to have a documented procedure for how they're going to provide notification to the appropriate regulatory authorities. And records of reporting to regulatory authorities need to be maintained, so a new requirement here. 826, your monitoring and measuring records need to include the identification of the particular piece of test equipment used to perform that monitoring or measurement activity. 8.3, some changes related to your procedure for control of non-conforming product. It must define the responsibilities and authorities for the identification, documentation, segregation, evaluation, and disposition of non-conforming product. The evaluation activity needs to include a determination of the need for an investigation and notification of any external party responsible for the non-conformity. And records of the evaluation, investigation, and rationale for any decisions need to be maintained. Also in 8.3, actions in response to non-conforming product detected before delivery are now in 8.3.2 and are separated from actions in response to non-conforming product detected after delivery, now in 8.3.3. Specifically in 8.3.2, non-conforming product accepted by concession can only be done so if justification is provided, appropriate approvals are obtained, and applicable regulatory requirements are met. And regarding non-conforming product detected after delivery, the organization shall document procedures for issuing advisory notices in accordance with applicable regulatory requirements. These procedures need to be able to be implemented at the ready, and records shall be maintained of any actions taken under this. So really a separation of pre and post delivery handling of non-conforming product to really separate some of the distinctions between how they need to be handled. 8.4, analysis of data. Requirement here for a procedure, and it shall now include determination of the appropriate methods, including any statistical techniques needed and the extent of their use. And the analysis of data included in this category is input from audits and service reports as applicable. So that would mean first, second, and third party audits and any servicing reports. 8.5.2, corrective action, and 8.5.3, preventive action. The required procedures need to include a verification that the corrective preventive action does not adversely affect the ability to meet applicable regulatory requirements, nor does it impact the safety or performance of the device. And that's it with the prepared part of today's presentation. I think one of the overwhelming themes we see is a lot of requirements for documented procedures, documented information. We'll now open the floor to any questions that you may have. Getting a lot of repeat questions on the availability of this webinar after it concludes. And all presentations will be available for download, and a recording will be accessible within 24 to 48 hours after this presentation. Great question about an organization that manufactures and supplies components to the device manufacturer. I'm assuming you mean the legal manufacturer. What role should we state in the QMS? In this case, you're not assuming any of those 4 roles, so state accordingly. So again, a repeat question, and I'll just restate this. Is a contract manufacturer considered a manufacturer under the standard, even though we don't market the device under our name? It's under our customer's name. You aren't necessarily meeting the definition of a manufacturer. You don't hold the device license. So you can identify as a manufacturer. However, there still may be some regulatory requirements that you have to meet, Jody. We're getting some comments that we're having a hard time figuring out what's new and what's changed. Obviously, any organization has to do a gap analysis against the 2003 versus 2016 requirements. Some things may already be implemented in your own management system, Joanne, that weren't required by 2003, maybe because of some customer or regulatory requirements, which might put you in great shape for the transition. Someone's asking about pest control for an electronics contract manufacturer. How far do we need to go? Let's scroll back to the relevant section here. Um, 641, 642 would be the applicable requirements, Terry. Yes, I would definitely think that pest control would be part of the requirements needed to maintain the work environment to achieve conformity to product requirements. A pest control shall be part of your documented requirements. I hope that answers your question. Component manufacturers not making finished devices, complaint handling, device history, and design elements may certainly be applicable, Michael. Just because you don't hold the device license, many of these requirements are still applicable. I would work with your customers and understand the regulatory requirements to determine the extent of applicability, but you certainly cannot take those as exclusions simply because you're not the manufacturer of the device. Someone's asking if it's possible to get a design exclusion. You can only get a design exclusion if your customer provides the design specification to you. That's the only way. If you're designing the medical device, you have to fulfill the requirements of 7.3. Getting a question on the requirement for listing measuring devices. Can you expand on this clause? Yes, let's go back to it. If I can find it here. Here we go. So obviously you would keep inspection and test records for all inspections and tests that you're doing, showing the results, pass, fail, who did the inspection. Now, Dermot, one of the things you would be doing is identifying somehow the test equipment used to perform that, maybe by a unique identification number. Question from Roxanne on, she says human resources, but I think the heart of the question is the best way to define competence of employees. Could you expand on it a bit more? Yeah, I think this is a huge weakness in many organizations, regardless of the standard or criteria that they're implementing. as an auditor, I'll see in an employee's file training records, but there's no default to ensure that all competency requirements are being met because the organization has failed to define the competency requirements for a position. Once those competency requirements are defined, you can determine how the individual meets them. They may meet them based on education or prior work experience or maybe some testing or certification, and you don't need to provide training. If they don't meet them, you may need to fill that gap in that competency void by the provision of training. But that first step, the identification of what competencies are needed for a position, is what's often missing. Wait a few more minutes to see if we get any other questions. Again, folks, I'd encourage you to transition on your recertification audit. No additional time will be added. If you're not ready till the time of your surveillance audit, know that a half day will be added to your audit to ensure that all the additional requirements can be effectively audited in the time allotted. And as I have stated many times, many of the requirements relate to requirements, new requirements for documented procedures, documented information, etc. Again, the presentation, Wayne, will be available for download as well as a recording. Check out our website, www.pjr.com, for access to this and any other webinars that have previously been conducted. It's also there where you can access a schedule of upcoming webinars on many other topics. We'll wait just a few more minutes to see if any other questions come in. Do contract manufacturers have to meet the advisory notice clauses? Yes, you may very well have to meet those, Jody. I think the best way to determine that is to refer to your customer requirements and the regulatory requirements. Okay, folks, it appears that there are no additional questions. I thank you for your time today. I know it's valuable, and we look forward to seeing you on a future PJR webinar.